hypertriglyceridemic patients first to be like really comfortable with treating them. And that's why it's so important to add on that triglycerides. But that medication, you know, the majority of those dogs are going to respond to the diet. But then if they're still not responding, they're the ones we have to add in these other drugs.
Sure.
And they may be cases where you want to chat with your local internist or other things before using them. But they're certainly very effective and very safe drugs.
I feel like I'm going down the rabbit hole here because now I have so many questions about triglycerides. But what if they're non-clinical for the hyperlipidemia and that, you know, they're not having any signs of pancreatitis or GI upset?
Yeah, so in those cases, even when they're not showing active signs right now, if those triglycerides sort of in those, you know, 800-ish range, those animals are at risk of developing pancreatitis. So I'm still going to try and control those triglycerides now in the hope that treating this is going to prevent a future episode of pancreatitis, and putting the money in now may help to save a lot more money in the future.
Okay, that makes sense. I will take a closer look at those triglycerides. Yeah. I do feel like they come back on a lot of my chemistries, and you know, I have been known to recheck them when they're really high and say bring them back with a fasted sample and let's see. But I don't think in my non-clinical patients I've gotten really aggressive with worrying about it, so I will pay much closer attention to that going forward. What about chronic versus recurrent pancreatitis?
Yeah, so right now we sort of don't have a lot of data on is this, you know, chronic disease, or is this acute on chronic, or is this recurrent flares? To me, the question still becomes, until we get more data on how to manage these, you know, truly histopathologically chronic cases, is I have an animal that keeps getting pancreatitis, whether this is, you know, acute disease and it's going away and then completely coming back anew, or if it's an acute on chronic or chronic that's clinically severe. All of those cases ultimately are patients that are having pancreatitis that are at your hospital. So in those cases, we still treat them the same in terms of supportive care, adding in novel therapies such as Panaquil CA1. But the next question becomes is there a way that I can help prevent this patient coming back through the hospital or through the ER or, you know, wherever it's going to present? And those are the ones where I try and go back to the causes, and I try and screen more aggressively for underlying causes. So that may be the one where we ask a little bit more detailed food history. That may be the one where we say, okay, you know, we didn't do the triglycerides last time because we tried to save a little bit of money. Let's do the triglycerides now. Let's also look for other risk factors. Could this animal be Cushingoid, hypothyroid, or diabetic? You know, hypothyroid, we have to wait till they're clinically well to test. Same with Cushing's. Looking for these underlying causes where we can. There are very, very rare cases of drug-associated pancreatitis, which I don't think we really talk about because they're so rare. But I've certainly seen a case or two that have been referred to us for that. There are certain drugs that are out there. There's a lot of them that have been reported in human medicine and various individual case reports. So certainly not something that you'd be expected to have come across in practice or even, you know, in specialty medicine. But there are drugs, and the ones that I feel have the most evidence behind potential associations with pancreatitis is phenobarbital, potassium bromide, so a lot of our seizure medications, and then L-asparaginase, which is a chemo drug.
Okay.
So the times where I see those cases, it's normally an animal with idiopathic seizures, and they're on phenobarb or phenobarb and potassium bromide. Sure. And those animals may be developing pancreatitis secondary to those drugs. And in those cases, we have to think, okay, which disease are we prioritizing? Can we switch these anti-seizure drugs to a different medication? I haven't yet seen any cases related to Keppra, so Keppra may be a suitable alternative for those cases. But those drugs can also be, going back to lipids, can cause high lipid levels. So again, controlling the lipids may be an alternate approach to those tricky cases as well.
Okay, that makes sense. You know, they're being metabolized through the liver and so potentially causing this hyperlipidemia, but maybe we can keep them on those drugs and give them something additional to bring those triglyceride levels
like a low-fat diet, or if that's still not working, thinking about some of those other treatments, or saying, okay, is this a patient that would be safe to potentially transition to another anti-seizure drug? And that's going to be really case-dependent.
I feel like I'm learning so much here. This is very exciting.
Awesome. And there's just to help people sort of find where those lists of drugs are. We published a review article, open access, in the Journal of Veterinary Internal Medicine. I think it's called New Insights into the Etiology and Pathogenesis of Pancreatitis. And there's a table in there that sort of has all the potential risk factors for pancreatitis in. So I use that as a bit of a checklist in these recurrent cases as, have I looked for this? Have I looked for this?
That's a fantastic resource because it is so multifaceted to be able to kind of have that checklist, that algorithm, so to speak. And if I'm hearing you correctly, it sounds like it doesn't necessarily matter if it's acute on chronic or recurrent or whatever it is that we're looking at, we're still going to screen for the risk factors in the same way and check off our checklist and see if we can find the underlying cause and treat it.
That's absolutely sort of where we're at right now. In the future, if we get more data on these chronic cases, perhaps we may treat those a little differently. But for right now, I still treat those as a case of pancreatitis, and I try my best to find a reason why they have it and why it keeps coming back. And if we can find something and treat it and reduce the frequency of disease in the future, that's absolutely going to be best for the patient, it'll be best for you, and it's going to be best for the owner as well.
Sure. What about one of those, kind of strange GI presentations like a lymphangiectasia or something? Would that be a risk factor?
Yeah, so there have been some studies that have looked at sort of these chronic neuropathies and elevated pancreatic lipases. I've certainly seen a few cases where they have, primary GI disease and then also secondary pancreatic involvement. So, yeah, if there's certainly signs of other disorders, treating the underlying disease may be beneficial as well.
Sure. So it could be associated with like a chronic enteropathy or something as well. Prognosis. We mentioned in the beginning, sometimes it's a mild GI upset and they resolve with, 24 hours of supportive care. And then other times, we can get necrosis and even up to being fatal. What is the overall prognosis for patients with pancreatitis? And does it matter if it's acute or chronic?
Yeah, so this is, again, another really big question we have. And in veterinary medicine, when we sort of look at what data's out there, one of the things we have to think about is that data that's out there shows like fairly high mortality rates. But they're typically from, tertiary referral academic centers or even from several, decades ago. So we don't have a really good data set that looks at the true presentation. A lot of these cases are being treated really, really well in general practice, and they never come to academia.
Sure.
And they probably have a much, better prognosis than what we potentially see. So the prognosis question is probably going to be very frustrating, but we don't really have a good idea. But, going back to sort of broad generalizations, there can be patients that do absolutely fantastic, need brief supportive care and do really well. But they can change, and when they change, they can change fairly rapidly. So making sure that there are options for more advanced care where we need them is going to be important. And an animal, still, even despite new treatments and all this other supportive care and, the best support we can give them, some of them can still pass away from these diseases as well.
Sure. So it's kind of the universal answer to medicine.
Yes,
it depends.
It really depends. Yeah.
But I think that's good to be aware of, because then it facilitates that client communication of, look, we feel pretty good about our plan here, but this could change rapidly. So be aware of that. Here's what to look for, and here's when we need to refer and get a little bit more intense with our supportive care.
Yeah, and that's a really great point, is these client conversations is, if this patient presents to us sort of mild and we're like, okay, let's treat it supportively, let's do the things that we usually do, and we send them out the door, we need to make sure that that owner knows that, things can change, and at least in my opinion, it can change a little bit faster than some of those other disorders we sort of treat on a outpatient basis. So having that conversation first really helps, that if that was that patient that comes back more severe, they've sort of had the heads up. Right.
And they're prepared and they know when to call. So they're not going, well, you said it was going to get better. Yeah. So I figured I would just wait it out. And you're like, oh, no.
Exactly.
So along those lines of client communication, we've talked about how it can kind of make our heads spin as veterinarians between the variability in presentation, the supportive care, having to kind of sit on your hands and wait it out, which can be challenging, and how rapidly these cases can change. It's a lot for us to take in. It can be a lot for a client to take in that conversation. Do you have any tips for communicating with clients about pancreatitis, kind of what to expect and what to look for and how to be prepared for that?
Yes, I think, a lot of what we touched on is sort of having those conversations with the owner early on. So, at the moment, your dog is presented fairly mild and we're confident that our treatment plan is going to help support your dog, but potentially, things can escalate a little bit rapidly. So we want you to be part of the team in monitoring for these adverse effects and sort of letting us know when they occur, because we may need to bring that animal into the hospital. We may need to send them somewhere where they can be watched a little bit more closely, and having that conversation up front. And that's a conversation I think most vets are really, really good at having. The one thing that, I think is sort of on the back end when the animal recovers is, hey, as a heads up, some animals can get recurrent episodes of this disease. Right now, we don't have a known cause for what's going on in your dog, but we're going to still be careful with table scraps and various other things. But if these animals keep presenting and you keep coming back to us over the next few years, we may want to do some additional screening to try and work out is there something going on that means that your dog's affected more commonly than another dog? Because then at least if we've had that conversation again, when we say we want to do these extra blood work tests, we want to do these other things, the owner knows that sort of we're on the same team and trying to help get that animal better and prevent them having to come back and keep spending so much money in hospitalization.
I think that's such good advice of kind of planting that seed early of, especially I think of something like Cushing's disease, if that's the underlying cause, and that can be kind of a bear to diagnose. So kind of planting that seed early on of like, look, if this keeps happening, we really need to go down this road of finding the underlying cause if we can. And so that way, if we do have one of these patients that we're having to treat continuously and it is, adding up financially, that's something that we've had that conversation ahead of time and the owner has had a chance to wrap their head around it and decide kind of where they want to go with things. And it's a less difficult conversation when you're treating pancreatitis for the second time or the third time, which is expensive and intense as it is. And now we're talking about adding on these additional tests. They kind of have that idea early on. So that's such good advice to say, just plant that seed from the beginning.
And it's also, we're all very busy veterinarians, right? When that patient comes in and we expect a fairly routine appointment and it turns out to be something else going on. If we've got sort of documented in the last visit, hey, this was thought to be a one-off, but these are the things we may check in the future. So like sort of a good heads up for us as well as, like we're really busy, we get caught in the moment, but hey, this has happened before. Maybe I need to add on this extra blood work now.
That is so true. Yeah, I will. I have been known to write notes to my future self of like, this is what you were going to do if your plan didn't work.
Exactly.
And this is the perfect scenario for that.
Yeah.
Well, Dr. Cridge, I have learned a lot from this talk. I know it's definitely going to affect the way that I interpret blood work and communicate with my clients and treat pancreatitis in the future. So I hope it's really beneficial to everybody out there listening. And I so appreciate you coming on and going through all of this with this really complicated disease. Any other thoughts you want to share with us before we wrap up?
I mean, that's the biggest thing is, we need to sort of give ourselves some grace. These are really, really complex cases. But, people are always there to reach out to if we need any additional help. And I'm so excited to have been able to chat with you and be able to reach the audiences that we can with this podcast. So thank you so much for having me.
Absolutely. I can't wait to go find that paper in the Journal of Internal Med and use my checklist the next time I get a pancreatitis case.
Awesome.
All right, a big thank you to Siva for making this episode possible. Dr. Cridge, thank you so much for joining me and for all of the great information. And of course, thank you to all of you listeners out there for tuning in. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcasts. It'll help other veterinary professionals like you find this and other great content that we try to put out there. For more episodes like this, click on the Education tab on the Vetfolio website. As always, we'd love to hear your input on this talk, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.